I've had two scenarios like this pop up of late. There is such a barrier to cover to go from, someone who needs surgery. Oh no, we gotta do physical therapy first. So they need an MRI. No, we gotta accomplish this many sessions of physical therapy. That costs money.
Right.
At the end of the deal, it's
the protocol.
still gonna be needed. Or do they think that people are gonna fall off and just not go all the way through it? They're not gonna complete the physical therapy, and so then they won't go get the other thing done?
Statistically, half people, 50%.
So that's
don't end up
that's a
there.
worthwhile risk for them.
The other thing is that I can give them PT, and that costs me pennies. And I give you surgery, it's $100,000
Right.
or $200,000, or whatever.
I got a brother-in-law who, his doctor at Mayo said you need this spinal fusion surgery. It's
Right.
vertebrae were deteriorated. He's literally in the operating room.
Right.
They've literally just administered anesthesia to him. And they get a phone call in the operating room from the insurance company and said, the surgery is not approved. He did not complete the necessary numbers of physical therapy. They literally woke him back up and took him out of there after 5. And the doctor's like, you can't do physical therapy. Physically, you cannot do physical
Right.
therapy. That's why you need the surgery. After 5 appeals, it falls into January, brand new year,
Oh,
new
yeah, yeah.
deductible.
Yeah.
Oh, now it's all out of pocket.
Right.
And so he finally got the surgery done last week.
Right.
But it was not until they had pushed it over into the other, and they're literally calling into the operating room and
Who was
stopping
this
it.
payer?
Who was I think it was United Healthcare.
I mean, that's very classic, I didn't know who it was.
And
but-
my wife had had something not to that degree, but she broke her shoulder, fell on her shoulder, came back. They didn't know that she had broken it. They had, they isolated. She fell on it when we were in Hawaii, and she flew back, and so she went in, and through JOI was going through this process of looking at it. She had a 90% tear in her rotator cuff, and so
Right.
she was going to do rotator cuff surgery, but they couldn't do an MRI until she had completed a certain amount of physical therapy. And so she's going through physical therapy with a broken shoulder before they really realized.
Did they know this?
No, they didn't. They didn't know that she had a broken shoulder, and then
No, I
they
mean, the
finally-
insurance company said,
Right.
knows it. They say, make it so difficult. That's
When they
another.
finally realized it, they said, "Stop physical therapy. You need." But what had happened? God does what God does. Her isolation of that allowed it to heal, and it healed 90%.
Right.
So when the doctor went in to do the surgery, he came out 30 minutes later. He said, "I can't do better than what God did. She's got a 90% heal."
Right.
So there's a 10% tear. I don't think it's worth fooling with it.
Do a little therapy on
so
that.
Pull
and
back
then-
out, right? So now she's not having to recover like you would from
See,
normal
that's where
surgery.
that's where your concierge guy goes, okay, I agree.
Yeah.
Or, I don't agree.
Right.
Do it.
You also mentioned MediShare.
Uh-huh.
What are your thoughts on that?
Well, first, I like it.
Uh-huh.
I like it because it is hugely less cost. Okay, all of this 15%, let's call it cloud in these privates, which is more like 50%. Okay, but all these games and all that you lose because the margins are much tighter. Okay, and the outcomes are monitored much more closely. Okay, you hear them advertise, whether it be Samaritan or MediShare or any of the other non-religious share. There are some non-religious
Right.
shares.
Yeah.
They're advertising how many people we treated, how many people got, what our rating was, 90%. They're advertising this outcome model, right? Where United wouldn't touch it.
No, right.
Yeah. But it's a game to deny care in the real private world, or to reduce care, or to go through the algorithm and give you some. Again, you under the old system, you were the patient. The system was treating you, and now the system is the patient, not you. You're just a component part of the system.
They've taken the attorneys, deny, delay, defend.
Right. That's but you're talking about attorneys, I'd say they have a actuarial statistic that they're
Right.
prepared. They'll say 1 in 1,000, 1 in 10,000 will actually sue us, and we'll go settlement before it ever goes to trial, and we'll pay them some minimal part, just $10,000. We used to I used to, in the public companies, we would, for internal lawsuits, what I call people suing the company for internal reasons, we booked 50 grand on the books to the public company, so you could, under the lawsuit section of your Q and K, you would look under it and you'd see how much we were booking for those internal, but there was a prescribed, every time one came in, okay, we're gonna book $50,000 because we're gonna settle, they're coming in with X, Y, and Z complaint, we book it $50,000 that we'll pay out to cover that, either in legal fees or in payout. So it sounds cruel and hard, but it's the way these public companies have to deal with it because they get a bunch of these suits that don't relate to anything. And so that drives everybody crazy.
I know a lot of people I talk to about medical type stuff. When you go to the doctor, 70% of people show up and whatever the doctor says, they walk out like a zombie and they do whatever the doctor says.
Right.
So the doctor is basically driving the direction of what's going on.
That's right.
And most people don't take responsibility for their own health.
Right.
Or at least own, okay, I've stepped in this mess, I need to get this off of me. My experience in dealing with, and I go through Mayo, I look at my doctor as a medical concierge. He's got a key that gets me into some things that I can't get into from the street. And so if I go in there and I have in mind, I want you to check my D3 levels, I want to see where I'm at from that standpoint, because I know a higher level is going to imply a better immune system and protect me in certain areas. We need to check these things on a regular basis. I'm basically going in and establishing an executive level physical in what the blood work is I want them to be checking and following up on. And so he basically sits down there and all he does the whole time we're talking is he types in orders that I give him that he can, obviously we're not going, hey, let's have an MRI for fun, but in those areas like, hey, I've got this thing going on over here, do you think let's go get that x-rayed, or hey, I've noticed a little bit of difference here, what do you think about that? Hey, let's go get that, check that over here. So they get me into places where I need to go, but I mean, obviously, if I'm not gonna be responsible at that point, then.
Well, I did that with my wife at Mayo. She works at Mayo, she was going to her doc, and I said, look, she was having trouble with menopause. And so I said, you need to go in and ask for these labs, okay? So she did, they did them. Mayo only paid, she has insurance in Mayo. Mayo only paid pennies. We paid $5,000 out of our pocket for running those labs. Wow. So be
Doesn't
careful.
she work for them?
She works for them. I have better insurance than she does. I have Mayo, which pays their penance. And then under Medicare, you're a participating provider, so you can only bill Medicare so much. So my second is Medicare, so everything drops to Medicare, and so if they're billing more than Medicare says you're allowed to bill, they can't bill it. So they take the Medicare payment. I never pay it.
Well, we're having huge problems, not just in that, but even with workers' comp that I have. Because in my industry, we're in construction, we do get injuries.
Right.
So I've been better off, and by calling providers and saying, this is gonna be employer managed healthcare, so that way you don't have to charge me extra, just charge me for that visit. You don't have to bill the insurance company, you don't have to wait months to get paid, you don't have to do this whole process. And so I'm finding that's managing, and then also like MRIs, they say, well, you do our MRI, it's gonna be, it's gonna be $1,800.
Right.
I said, well, I know guys, I can get it for $180.
Right.
I said, yeah, just
doing
go
the right thing.
Right, so just go to the MRI and bring us the CD. That's all we do. So we still get the care without something crazy. I had a guy last year, he just working over at Duval County School, he was putting a nail, doing scaffold, nail ricochet, came up and went between his safety goggles and went into his eye. So we had to have surgery.
Right.
So we took over HCA, he did the surgery, got out. Doctor sent me a bill for like $300-400, wrote him a check.
Right.
Hospital sends me a bill for $115,000. I said, I'm not paying that.
Right.
So then it went through the process, then they come back and said, I said, I'm just gonna write you a check. You don't have to go they said, give a check for $11,000. So I wrote him a check. So it's,
But you're the educated, and same thing with you, you're the educated consumer.
Right.
This is what the advocacy model does. You have to have somebody that's educated in the system to be able to help you manage the system. With PSA, I had 30,000 employees in the United States, across the United States, about 3,000 direct employees, the rest of them were part-time. I had a huge workman comp issue because these nurses were floating around in the community and caregivers, whatever. I started drug testing on every incident, and my cost went, my incidents went, because 90% of workman's comp, over 90% of workman's comps there were drugs on board with the individual.
Wow.
So that's how I manage it. But then I also manage it with, because I'm the one providing it, right?
And workers' comp does provide a valuable service to me, because all of a sudden you get a guy where, you know, he gets hurt, I'm paying, instead of him going on workers' comp, getting 2/3 and all the junk they put him through.
Right.
I say, hey, go to the doctor, I'll continue your pay.
Right.
And going on, then all of a sudden he'll get an attorney and I'll say, look, do you really wanna do that? I can't stop you,
Right.
but now I have to put you through their system. So
Right.
it protects me, they got attorneys, they just handle it.
Right.
You know, it's harder for him, they usually regret it, they don't get their pay, they don't get anything else.
So readily.
Yeah.
give
Yeah,
it to
but I
them.
have employees that are good employees, I keep paying them, they might be out 6 weeks, they keep getting paid,
Right.
they get healed, they get better, they come back to work, everybody's happy.
Long term, that's a
So-
real benefit, isn't it?
Right,
Yeah.
and so having, and
Well, that ability to have a relationship with your employees is rare.
Yeah.
Okay, out there for a big company, or a strong company.
So-
Most, especially in healthcare, most people hire that nurse and treat them like trash, even though they're paying them $100,000 a year.
well, it makes a lot of sense, like when I was in high school, I went to work at Gate Rubber Company, and they had a medical facility across the street. So in the big plant, they're building
Oh, yeah.
tires and fan belts, and we had a guy, his finger got cut off, took him off the street, they put the finger back on, you know, they had doctors, they had a whole facility across the street that took care of their employees. And it was like, that kind of makes sense to me, you know, so finding a way to take care of my
So the key
people.
word is advocacy. You've got to, in the current environment, you've got to advocate.
Yeah.
You know, have to understand the consequence. I didn't understand the consequence of my advocacy to my wife, we've only parted ways.
Yeah.
And the other thing was, if I'd have drawn the labs at outside of Mayo, it'd have been $1,000.
Or if you did it at this date and time as a part of this appointment, rather than just specifying, so it's like, you know, you gotta do these things on your physicals.
Right.
And thankfully, my general practitioner is like, this is a month before your physical, we can try and pull it, they might challenge it. Go ahead and do it, I don't care, I'll pay for it extra, or, yeah, let's wait till, I'll see you next month.
Right.
And you navigate that. My wife had because her mom had breast cancer beforehand, she met the qualifications to get tested for this genetic type stuff.
Right.
And I got 12 kids, so I've got 7 that are still under me for insurance, so I'm getting hit by deductible every year.
Right.
Okay, if we gotta spend it, we gotta spend it.
Right.
And so navigating through some of that stuff, but some of that, like, she had a lymph node, didn't know it was a lymph node, they thought it was like, this didn't feel like a lymph node, the doctor's like, I've never felt like this in my life, but it was
Right.
behind the back of her head at the base of her scalp. And they basically had to go in and surgically remove it,
Mhm.
and then have the pathology sent off to UAB,
Right.
to get it tested, cause that was like the head point for testing these things. Cause they thought it might have been a neuroma
Right.
of some sort that was a trigger for certain genetic whatever, and so my daughter winds up getting all this genetic testing as a result of it.
Right.
But it checked all the boxes, got the approvals, and
Right.
then was authorized to be done. And so it turned out she didn't have there was no genetic issue, it was just an enlarged lymph node.
Right.
But it was like, you know, you have to, okay, stop, it's like the Panama Canal, okay, stop, all right, we're gonna wait for that to go up, all right, yep, approved, go forward, you know.
Right.
all right.
You just have to stay with the system. And again, advocacy, you're fortunate, I think, to go through the system and with that level. I had that with my daughter too, my youngest daughter. Had some testing and my insurance paid for that, but that was, you know, the doc.
They could have fought it, they could have just fought it, yeah.
Well, past